Today we're diving into an urgent topic, loneliness and social connection. According to the WHO, social connection isn't just nice to have, it's essential for mental and physical health. The WHO's recent report on social connection highlights just how critical it is to our well-being. What do you think about this, especially in our fast-paced, tech-driven world?
It's pretty staggering when you think about it. Loneliness isn't just about feeling alone, it's actually linked to serious health risks like heart disease, stroke, and even premature death. I was shocked to read that loneliness contributes to around 871,000 deaths annually. That's huge. And we tend to overlook it, don't we?
Absolutely. It's often treated as a personal issue, but really it's a public health crisis. The report makes it clear that social disconnection affects people of all ages, from adolescents to the elderly, and the consequences can ripple out, not just affecting individuals, but entire communities and economies.
Yeah, and I found it fascinating that the report points out how loneliness can differ across cultures and age groups. For example, loneliness is more common among adolescents and young adults, and it seems to be more pronounced in low-income countries. Why do you think that is?
It probably has to do with societal and economic factors. Younger people are navigating identity and relationships, which makes them more vulnerable to feelings of disconnection. And in low-income countries, there might be fewer resources and opportunities for social interaction, increasing the likelihood of both isolation and loneliness.
Right. And the report also highlights marginalized groups, like people with disabilities or LGBTQ+ individuals, as being more prone to loneliness. The stigma surrounding loneliness doesn't help either. People might feel embarrassed or ashamed to admit they're struggling, which just adds to the isolation.
And that's a big one. Stigma is a major barrier to seeking help. People often suffer in silence because they don't want to be judged. The whole idea of "I should be fine" makes it even harder for those feeling disconnected to reach out. We need to change that narrative.
Exactly. So, what can we do? The report suggests a combination of policies, community strategies, and individual actions. It's not a one-size-fits-all solution, right? What stands out to you in terms of interventions?
There's a lot of focus on strengthening social infrastructure, things like parks, libraries, and public transport. These are small things, but they create spaces where people can connect naturally. And I think this is where digital technology can play a role too, especially with virtual communities or online support groups. It's about making connections more accessible.
I agree. Digital tools can help, but they need to be used in a way that fosters real connection, not just digital busy work. The key is balance. Also, there's an emphasis on policy. Countries like Denmark, Germany, and Japan have already adopted policies focused on loneliness, which is a step in the right direction. Governments need to treat loneliness as a public health priority.
For sure. And speaking of policy, what about the workplace? Do you think employers have a role to play in addressing loneliness?
Absolutely. Workplaces are a major part of people's social lives. If they're isolated at work, it's only going to make things worse. Employers can foster social connection by encouraging open conversations, offering support for mental health, and creating environments that promote interaction. Not just work, but human interaction.
It's all about connection, whether it's at home, in the workplace, or through community engagement. The WHO's report makes it clear that action needs to happen at all levels, from individuals to governments. We have the knowledge, and now it's time to scale up solutions.
Exactly. So, listeners, take a moment to think about your own connections. Are there people around you who might be feeling isolated or lonely? Let's all take a small step today to reach out and foster connection. Because, as the WHO says, it's not just a nice to have, it's a necessity for a healthy society.
Absolutely. Let's keep this conversation going. What's one thing you can do today to help someone feel more connected? Let's make social health a priority together.